Hello, my name is Michelle Peacock and I'm doing a presentation on myocardial infarction. The objectives of this course are to teach you how to analyze an EKG and interpret for potential ST elevation in I, also known as STEMI, to be able to list 4 symptoms of myocardial infarction, to be able to list 2 medications that are important to take after having a myocardial infarction and why they're important, and finally, to be able to list 1 lifestyle change the patient should make after having a myocardial infarction. Myocardial infarction, as described by Reeder and Kennedy, is defined as a clinical or pathological event caused by myocardial ischemia in which there is evidence of myocardial injury or necrosis. The mortality rate after STEMI is as high as 10% in the first 30 days and as high as 21% at the 5-year mark. There are also many complications of myocardial infarction to include sudden cardiac death, angina, stroke, recurrent MI, and heart failure. Normally, blood enters the heart through the superior and inferior vena cava, where it goes through the right and left atrium and ventricle, into the pulmonary circulation, where it is reoxygenated, to come back into the left atrium and ventricle, where it is then ejected out of the heart through the ascending aorta. It is here that some blood enters the coronary circulation. There are a couple main blood vessels, such as the left main and right coronary artery. These different vessels provide different areas of the heart with blood. Once the blood is provided to the heart, it leaves the coronary circulation through the coronary sinus, where it is emptied back into the right atrium to repeat the process to be reoxygenated. Myocardial infarction occurs when there is a blockage or a supply and demand issue, and the heart does not receive enough oxygen and therefore starts to have ischemia, injury, and finally infarction. The main ways that blood can be prevented from getting to different areas of the heart are either through a blockage, such as a plaque buildup that ruptures, causing a thrombus, preventing blood from getting through. There's also vasospasm, where the vessel constricts down so tight the blood is not able to get through in adequate quantities. And then there's the supply and demand issue, where there is an open blood vessel, but not enough blood or oxygen can get to the area of the heart, causing this ischemia, injury, and infarction to happen. The signs and symptoms that occur during this event are initially pain, primarily in the chest that radiates into the left arm, though it can be either arm, and into the jaw, that is not affected by repositioning, movement, or respiration, or palpitation. Other symptoms include diaphoresis, nausea, vomiting, and syncope. Do remember that pain is not always typical. Sometimes it is atypical and can present as epigastric pain, back pain, or other potential pain. Other symptoms that can occur depend on where in the heart there is the infarction. Some symptoms include hypotension and heart block. In this diagram, you can see the different areas of the heart that can be affected. The leads that you see this ST elevation on the 12-lead EKG, the vessel that provides that area of the heart, and the complications that occur due to that particular blockage. Now, interpreting the EKG is very important. When you get your 12-lead EKG, be very careful not to reverse the limb leads, because this can have a major impact and cause you to inaccurately interpret ST elevation. Once you get an EKG, you want to look at each of these leads and identify whether or not there is ST elevation in any particular lead. This is done by drawing a line on the baseline, which is the area between the T wave and the P wave, and you draw it through multiple complexes, and then you want to find the J point, as shown in this picture, which is where the QRS ends and the T wave begins. And then you want to measure the distance between these two lines. This is your ST elevation. It is significant if it is greater than 1 millivolts in all leads except for leads V2 and V3, where it must be greater than 2 millivolts. Do remember also that it is important to identify which leads the ST elevation is in, because you require at least 2 leads in the same wall of the heart to have ST elevation to be considered a STEMI. Also, a note is that if the patient is having the symptoms of a STEMI and you do an EKG and the symptoms don't resolve, even though you don't see ST elevation, to repeat the EKG every 15 minutes until either the symptoms resolved or you start to see changes on the EKG. Interventions. Their immediate interventions, we use the acronym MONA: morphine, oxygen, nitroglycerin, and aspirin. These are your emergency medications. They are meant to help you get through the initial presentation to intervention and help the patient in this immediate time. Interventions can include percutaneous coronary angioplasty, fibrinolysis, and bypass surgery. As shown in the picture on the right, you can see 2 examples of angioplasty, one with just a balloon and one with a balloon and stent. The idea of both of these is to smash this plaque or open the blood vessel if it's some other cause, to allow blood to flow through that blockage, and a stent is used to hold it open. Fibrinolysis is typically a medication that is used to help bust the clot. And then finally, bypass surgery is a surgery where they go in and bypass the clot with a vessel somewhere else in your body to provide blood going around the blockage. There is also the option for medical management and palliative care for those patients who do not qualify for intervention or are not stable enough to receive intervention. The medications that are important after and during the STEMI are morphine, which helps with pain. Then there's nitroglycerin, which primary benefit is vasodilation. It relaxes those blood vessels and allows the blood to move past the blockage, hopefully, to relieve the chest pain and the symptoms. There's the antiplatelet therapy, including aspirin, Plavix, and Brilinta. These help prevent another thrombus. This can occur in your stent or just in another vessel. It's very important to teach your patients that they must continue their antiplatelets as recommended by the doctor, because reclotting can occur even in a stent, causing another myocardial infarction. There's also the beta blockers, which are important to help prevent ventricular arrhythmias or other life-threatening arrhythmias. The statin drugs to lower your cholesterol and help prevent different and new myocardial infarctions. The anti-thrombolytic therapy drugs that help prevent other clots. Then you have your ACE inhibitors, which help prevent left ventricular remodeling, which decreases the effectiveness of the heart. And then there is your antiarrhythmics, which can help prevent a clot from AFib. Lifestyle changes that the patient needs to make are very important, such as smoking. Smoking cessation reduces the risk of recurrent myocardial infarction. There is also glycemic control. It's important for diabetics to control their diabetes to help prevent another myocardial infarction. Hypertension can also exacerbate symptoms, especially if there's still some partial blockages, because the blood pressure constricts that blood vessel, preventing blood from getting through. Good diet is important afterwards to reduce the chance of having another buildup and blockage. Exercise has been shown to increase the outcomes, make better outcomes for patients after having an MI. Stress management helps control symptoms and help prevent more problems. And finally, it is important to refer them to a cardiac rehabilitation program, which has been shown to increase outcomes and improve the patient's quality of life. Are there any questions? Well, thank you for coming, and I hope you learned something important today.